I think the emergency was really declared when the virus spread out of China and was entering into health systems that were patently not well equipped to deal with the outbreak. And that being associated with weaker health systems, where there are fewer surveillance systems, where people aren't accessing health services, aren't getting treated in public facilities when they're getting sick. And this is very much a feature of an underfinanced system. Countries spending only about 1% of their GDP in public health financing. And that was the situation in China back in 2002, before the SARS epidemic. China was spending about that much, and people were tending not to access health services when they were getting sick. Now, since 2002, the Chinese government have trebled their public health spend. In financial terms, that's about $500 billion in tax financing each year going into their health system, and they're better prepared this time. And we've seen this with a much faster response rate, and the government now able to build a hospital within a week, which is extremely impressive. Now, that hasn't been replicated, unfortunately, in some of its neighbouring countries that are continuing to spend about 1% of GDP and have a health system that's very inequitable, that richer members of society can access healthcare, but for tens, if not hundreds of millions of people, particularly in South Asia, people, when they get sick, are tending to go to private drug shops to buy medicines, often antibiotics, that in this case won't be any use really at all. So really the decision was made to raise the alert when it was entering weak health systems, like you see in South Asia, particularly in India, Pakistan, Bangladesh, Myanmar. I think there's less concern about the ability of countries like Thailand, Malaysia, Sri Lanka even, to tackle the epidemic, because they have a universal publicly financed health system.